Health, seniors, elderly, aging, arthritis, knee pain. If you're over 30, or especially in your 60s and 70s, your knees may be telling you something important about your overall health. Did you know that the shape, movement, and even swelling of your knees can reveal hidden health conditions, from arthritis to gout, even signs of heart or digestive issues? Today, as your arthritis doctor here in the US, I'll explain what your knee says about your health. We'll go step by step, covering 13 major conditions that show up in the knee, what they mean, what you can do at home, what foods to eat and avoid, and simple remedies that make a real difference. So if you care about staying mobile, independent, and healthy as you age, this video is for you. Introduction. Build trust plus context. Our knees carry us through life. Every step, every climb, every walk in the park, your knees are working. But here's the truth. Knee problems are not just about the knee. They can reflect deeper health issues in your bones, joints, immune system, and even your metabolism. For seniors, the knee is often the first place where aging shows itself. Stiffness in the morning, swelling at night, or pain after walking. But what if I told you these signs aren't just wear and tear? They may be clues your body is sending about your overall health. Let's go through them one by one. What your knee says about your health condition. 1. Knee hyperextension, Ehlers-Danlos syndrome. When your knees bend backward more than normal, almost like they're too flexible, this can be a sign of a condition called Ehlers-Danlos syndrome, EDS, a connective tissue disorder. Why this matters? EDS weakens collagen, the protein that supports your joints, skin, and blood vessels. That's why people with hyperextended knees may also bruise easily or feel joint instability. What you can do: strengthen muscles around the knee with gentle exercises like swimming, cycling, or resistance bands. Avoid high-impact sports that put stress on joints. Support your joints with vitamin C-rich foods like oranges, kiwi, and bell peppers, since vitamin C helps collagen production. Home tip for seniors: use a knee sleeve or supportive brace when walking longer distances. This prevents strain and gives stability. Condition 2, bow legs, osteoarthritis. If your knees curve outward, creating space between them when you stand straight, that's called bow legs. In adults, it's often linked to osteoarthritis, the most common type of arthritis in seniors. Why this happens? Osteoarthritis wears away the protective cartilage inside your knee. Without that cushion, bones rub together, causing pain, stiffness, and the bow-legged appearance. What you can do: focus on low-impact exercise, walking on soft ground, swimming, or stationary biking. Lose even 5 to 10 pounds if overweight. Each pound less takes 3 to 4 pounds of pressure off your knees. Eat anti-inflammatory foods, salmon, chia seeds, olive oil, leafy greens. Avoid processed snacks, fried foods, and excess sugar, which worsen joint inflammation. Home remedy: apply a warm compress in the morning to loosen stiff joints and a cold compress after activity to reduce swelling. Condition 3. Paget's disease. Sometimes knees can appear deformed or unusually large. This can be a sign of Paget's disease of bone, where bones grow abnormally and become weak. Why this matters? Paget's can cause bone pain, arthritis, and even fractures. It's more common in older adults. What you can do: ensure adequate vitamin D and calcium intake for bone strength. Foods like milk, fortified cereals, almonds, and salmon help. Gentle weight-bearing exercise like walking supports bone density. Avoid smoking and excessive alcohol, which weaken bones further. Home advice for seniors: get regular bone density scans if you're over 65 or have family history. Early detection makes treatment easier. Quick check for you. Have you ever noticed your knees bending backward, curving outward, or looking larger than normal? Drop a comment below. I read everyone, and your story may help others in this community. Condition 4. Hypertrophic osteoarthropathy, clubbing linked to cancer. Sometimes, When I examine a patient's knees, I notice thickening around the joints and even changes in the fingers and toes. This can be a sign of hypertrophic osteoarthropathy, often linked to lung or gastrointestinal cancers. Why this matters? When the body reacts to underlying cancer, it can cause abnormal bone and tissue growth around the joints. The knees may look swollen, tender, or unusually shaped. What you can do: if you notice sudden swelling or bone changes, get a medical evaluation quickly. Support your immune system with a diet rich in cruciferous vegetables, broccoli, cabbage, Brussels sprouts. Avoid smoking and limit alcohol. Both increase cancer and bone stress risks. Home advice for seniors: keep a health journal. Write down when swelling appears, what makes it better or worse. Patterns help doctors catch issues faster. Condition 5. Inflammatory arthritis. When knees are swollen, stiff and painful, especially in the morning, this may not be just wear and tear. It could be inflammatory arthritis, where your immune system mistakenly attacks your joints. Why this matters? Inflammatory arthritis includes conditions like rheumatoid arthritis, psoriatic arthritis, and lupus-related arthritis. These cause ongoing inflammation that can damage the knee joint permanently. What you can do: eat an anti-inflammatory diet: salmon, walnuts, turmeric, ginger, berries. Avoid processed sugar, fried foods, and excess red meat. These fuel inflammation. Gentle stretching in the morning can loosen stiff knees. Home remedy: soaking knees in warm water with Epsom salt for 15 minutes can reduce stiffness and pain. Condition 6. Inflammatory bowel disease, IBD. Here's something surprising. Gut issues can show up in your knees. People with Crohn's disease or ulcerative colitis sometimes develop arthritis in the knees. Why this happens? The immune system that attacks the digestive tract can also attack the joints. In fact, about 30% of people with IBD will have joint problems. What you can do: eat gut-friendly foods, probiotics, yogurt, kefir, prebiotic-rich foods, bananas, oats, asparagus. Avoid spicy, greasy foods that worsen gut and joint inflammation. Stay hydrated to reduce joint stiffness. Home advice: a simple warm compress on the knees can soothe flare-ups. But remember, managing gut health with your doctor also protects your knees. Condition 7. Psoriatic arthritis. If you have psoriasis, those red scaly patches on the skin, you may also notice knee pain, swelling, or stiffness. That's called psoriatic arthritis. Why this matters? Psoriatic arthritis doesn't just damage skin. It inflames the joints, often in the knees, hands, and feet. Left untreated, it can lead to permanent joint damage. What you can do: eat an anti-inflammatory diet with leafy greens, fatty fish, and olive oil. Avoid alcohol, processed foods, and excessive dairy, which may trigger flares. Gentle yoga or tai chi helps reduce stiffness without stressing the knees. Home remedy for seniors: applying aloe vera gel to psoriasis patches can soothe the skin and reduce irritation, while joint-friendly foods reduce inflammation from the inside. Quick question for you. Have you ever noticed a connection between your skin health and your joints? For example, psoriasis flares and knee pain at the same time. Drop your answer in the comments. You might help someone else connect the dots. Condition 8. Rheumatoid arthritis, RA. One of the most important conditions that shows up in the knees is rheumatoid arthritis, or RA. Unlike osteoarthritis, which comes from wear and tear, RA is an autoimmune disease. That means your immune system mistakenly attacks the lining of your joints, especially your knees. Why this matters? RA causes swelling, pain, warmth, and stiffness, often in both knees at once. It can also affect your hands, wrists, and ankles. If untreated, RA can damage joints permanently. What you can do: eat anti-inflammatory foods: salmon, chia seeds, turmeric, ginger, leafy greens, berries. Avoid foods that fuel inflammation, fried foods, sugary drinks, processed meats. Stay active. Gentle exercises like swimming, water aerobics, or walking reduce stiffness. Home remedy. A warm paraffin wax bath for the knees and hands can soothe joint stiffness. Seniors especially benefit from this simple therapy. Condition 9. Lyme arthritis. Do your knees swell suddenly and become painful, sometimes with fever or fatigue? This could be a sign of Lyme arthritis, which happens after a tick bite that spreads Lyme disease. Why this matters? Lyme arthritis often affects the knees, causing large, painful swelling. If untreated, it can lead to chronic joint damage. What you can do? If you live in or travel to areas with ticks, Northeast, Midwest USA, always check your legs and clothing after outdoor walks. Early antibiotic treatment works best, so see a doctor if your knee suddenly swells. Support your immune system with zinc and vitamin C-rich foods like citrus, bell peppers, and pumpkin seeds. Home advice. Use tick repellents when gardening or hiking. Seniors who walk in wooded areas should wear long pants and socks to reduce risk. Condition 10. Xanthoma. Cholesterol deposits. Sometimes small lumps or bumps can form around the knees. These may be xanthomas, which are fatty deposits caused by high cholesterol or other lipid problems. Why this matters? Xanthomas on the knees are not just cosmetic. They can signal serious heart or liver conditions related to cholesterol. What you can do, get your cholesterol checked regularly, especially if you're over 50. Eat a heart-healthy diet. Oats, whole grains, beans, olive oil, avocados, and nuts. Avoid fried foods, processed snacks, and high-sugar desserts. Home tip for seniors. Replace butter with olive oil or avocado spread on toast. Small swaps add up to healthier cholesterol and better joint health. Condition 11. Gout. One of the most painful knee conditions is gout. This happens when uric acid crystals build up in the joint, often causing sudden, severe pain, redness, and swelling, sometimes overnight. Why this matters? Gout attacks often start in the big toe, but the knees are a very common sight too. If untreated, gout can damage joints permanently. What you can do? Eat a low-purine diet. Cherries, berries, whole grains, vegetables, and low-fat dairy. Avoid red meat, organ meats like liver, shellfish, sugary drinks, and alcohol, especially beer. Stay hydrated. Drink at least 8 glasses of water daily to flush out uric acid. Home remedy. During a flare, apply an ice pack to the knee for 20 minutes at a time. Cherries and cherry juice are also known to lower uric acid naturally. Tell me in the comments, have you or someone in your family ever experienced gout attacks or sudden swelling in the knees? What helped you the most? Your tip could help another viewer today. Condition 12. Infection, septic joint. Sometimes knee pain and swelling aren't caused by arthritis or aging. Instead, they're caused by an infection inside the joint, known as a septic joint. Why this matters? This is a medical emergency. Signs include severe knee pain, swelling and warmth, fever and chills, difficulty moving the leg. If untreated, a septic joint can cause permanent joint damage or spread infection through the body. What you can do? If you suspect infection, go to the ER immediately. Seniors, people with diabetes, or those with weak immune systems are at higher risk. After recovery, support your immune system with a diet rich in vitamin C, oranges, bell peppers, zinc, pumpkin seeds, lentils, and probiotics, yogurt kefir. Home tip. While you can't treat a septic joint at home, you can prevent infections by keeping small cuts clean, especially if you're diabetic or elderly. Even a small wound can allow bacteria to spread. Condition 13, hemarthrosis, bleeding in the knee joint. Finally, let's talk about hemarthrosis, which is bleeding into the knee joint. This often happens after an injury, surgery, or in people with bleeding disorders like hemophilia or those on blood thinners. Why this matters? Blood in the knee joint causes severe swelling, pain, and stiffness. If untreated, repeated bleeding can damage cartilage and lead to arthritis. What you can do, if you're on blood thinners, common in seniors with heart disease, always monitor for knee swelling and bruising. Apply an ice pack immediately after injury to reduce bleeding and swelling. Strengthen your knees with low-impact exercise to reduce injury risk. Home tip: seniors should keep their homes safe, remove loose rugs, use supportive shoes, and keep floors dry to prevent falls that may lead to knee bleeds. Quick reminder: if you've ever had a serious knee injury, or if you're on blood thinners, have you noticed swelling or bruising in your knees? Let me know in the comments. Sharing your story can help others stay safe. What to eat for strong knees and healthy joints. As a doctor, one of the first things I remind my patients in the USA, especially seniors and adults between 30 and 70 plus, is this: your knee health starts in the kitchen. The foods you eat can either protect your joints or speed up damage. Let's go over the best foods for your knees and overall health. 1. Anti-inflammatory foods. Fatty fish, salmon, sardines, mackerel, rich in omega-3s, reduce inflammation in joints. Turmeric and ginger, natural anti-inflammatory spices. Berries, blueberries, strawberries, blackberries, packed with antioxidants. Leafy greens, spinach, kale, collard greens, high in calcium and vitamin K for bones. Dr. A.S. tip: seniors who don't eat much fish can add omega-3 supplements after asking their physician. 2. Foods rich in collagen and vitamin C. Bone broth supports cartilage repair. Citrus fruits, oranges, grapefruits, lemons help the body make collagen. Bell peppers and tomatoes, high in vitamin C, protect joint tissue. Home advice: a simple chicken bone broth soup with vegetables is an excellent senior-friendly meal that supports knee health. 3. Calcium and vitamin D. Foods: low-fat dairy, milk, yogurt, cheese, fortified plant milks, almond or soy milk. Egg yolks and mushrooms, good vitamin D sources. Seniors often have vitamin D deficiency, which weakens bones. Regular sunlight, 15 minutes daily, helps too. 4. Whole grains and fiber: oatmeal, brown rice, quinoa, whole wheat bread. Fiber reduces inflammation and keeps weight under control, which is crucial for knees. 5. Hydrating foods: cucumbers, watermelon, celery. Hydration helps lubricate joints. What not to eat for knee health. Now, let's cover the foods that actually harm your knees. Many of my senior patients in the USA are surprised when I explain that their diet is silently damaging their joints. 1. Processed sugars and sodas. Sugary drinks, candy, pastries increase inflammation and lead to weight gain. Even diet sodas can weaken bones over time. 2. Fried and processed foods, fast food, chips, fried chicken, loaded with unhealthy oils that cause joint inflammation. 3. Red and processed meats, hot dogs, sausages, bacon, high in purines and saturated fat, linked to arthritis and gout flares. 4. Excess alcohol, beer especially increases gout risk. Heavy drinking damages bones, muscles, and the liver, which also affects joint health. 5. High-salt foods, canned soups, packaged snacks, frozen dinners. Too much salt leads to calcium loss from bones and worsens swelling. Question for you: what is one food you've recently cut back on for better health? Sugar, fried foods, or soda? Comment below, I'd love to know. And your answer might inspire another senior watching this video. Home remedies for knee pain and joint health. As a US doctor, I often tell my senior patients that while medical treatment is essential for many knee conditions, there are also safe, simple home remedies that can reduce pain, improve mobility, and make daily life easier. Let's look at the best options for aging adults. 1. Hot and cold therapy. Cold packs reduce swelling and pain during flare-ups, arthritis, gout or injury. Warm compresses or heating pads help loosen stiff joints in the morning. Dr. A.S. tip. Seniors can alternate hot and cold therapy for chronic pain, 15 minutes cold, then 15 minutes heat. 2. Epsom salt soak. Magnesium in Epsom salt helps relax muscles and reduce joint stiffness. Add 1 cup of Epsom salt to a warm bath and soak your knees for 15-20 minutes. 3. Turmeric and ginger tea. Both contain natural anti-inflammatory compounds. Boil 1 teaspoon turmeric, 1-2 teaspoon ginger in hot water, add lemon and honey. Great for seniors because it's gentle, soothing and boosts immunity too. 4. Massage with essential oils. Oils like olive oil, coconut oil or mustard oil can be gently massaged on knees. Add a few drops of eucalyptus or peppermint oil for extra relief. Improves blood flow, reduces stiffness and helps with sleep. 5. Apple cider vinegar drink. A tablespoon of apple cider vinegar in a glass of warm water helps reduce uric acid, beneficial for gout and arthritis. Also supports digestion and weight control, which are crucial for knee health. Seniors on medication should ask their doctor first. 6. Aloe vera gel. Applying fresh aloe vera gel reduces joint inflammation. Works especially well for psoriatic arthritis when skin and joint issues combine. 7. Knee strengthening exercises. Seated leg raises, wall sits, and gentle yoga build strength without stressing the knees. Swimming and water aerobics are excellent for seniors because water reduces pressure on joints. 8. Weight management. Every extra pound of body weight puts 3 to 4 pounds of extra pressure on the knees. Even losing 5 to 10 pounds can make a huge difference for seniors. Replace 1 unhealthy snack with fruit or nuts daily. Small steps add up. 9. Herbal supplements, glucosamine and chondroitin, support cartilage health. Boswellia, Indian frankincense, natural anti-inflammatory. Omega-3 fish oil reduces swelling and pain. Always check with your doctor before starting supplements, especially if you're on other medications. 10. Lifestyle adjustments for seniors. Use a supportive knee brace during long walks. Keep a cane or walker handy if balance is an issue. Wear shock-absorbing shoes to reduce pressure on knees. Tell me in the comments, have you ever tried a home remedy for knee pain that actually worked? Maybe turmeric tea, Epsom salt baths, or even yoga? Your tip could help another senior watching today. Daily lifestyle habits for healthy knees. As a US doctor, I often remind my senior patients, your knees don't just age because of time. They age because of lifestyle choices. The good news is you can slow down knee aging and protect your joints with the right habits. 1. Stay active, but choose low impact. Swimming, cycling, walking, tai chi, and water aerobics are excellent for seniors. Avoid high-impact activities like running on hard pavement, jumping, or heavy lifting. Doctor's tip, aim for 30 minutes of gentle exercise 5 days a week. Even short walks after meals improve circulation and reduce stiffness. 2. Strengthen your muscles. Strong thigh and hip muscles take pressure off the knees. Exercises like seated leg raises, wall sits, and mini squats are safe for seniors. Remember, a weak leg marks a stressed knee. 3. Maintain a healthy weight. Every extra pound adds 3 to 4 pounds of pressure to your knees. Seniors who lose just 5 to 10 pounds often notice major improvements in knee pain. Replace processed snacks with fruit or nuts to reduce weight gradually. 4. Good posture and sitting habits. Don't sit for hours with knees bent tightly. It reduces blood flow. Use a chair with good support. Seniors should avoid sitting cross-legged for long periods. Stand up and stretch every 30 minutes if you're sitting. 5. Sleep and rest. Quality sleep is when your body repairs cartilage and tissues. Sleep on your back or side with a pillow between your knees for comfort. Avoid sleeping on your stomach. It twists your joints. 6. Safety. First, for seniors, use non-slip mats in bathrooms. Keep hallways well lit. Wear supportive shoes with cushioning. Remove loose rugs to avoid falls. Falls are the #1 cause of knee injuries in seniors. Prevention at home is just as important as treatment. 7. Avoid overusing painkillers. Many seniors take daily pain relievers for knees. Over time, this can damage kidneys, stomach, and liver. Instead, combine medication with diet, exercise, and natural remedies. 8. Stay hydrated. Joints need lubrication. Dehydration makes knees stiff. Seniors should aim for at least 6 to 8 glasses of water daily, unless restricted by a doctor. Add lemon slices or cucumber to water for taste and extra antioxidants. 9. Regular checkups. Seniors should schedule annual checkups for bones and joints. Early detection of arthritis, gout, or osteoporosis prevents long-term damage. Question for you. Which lifestyle habit do you struggle with the most? Exercise, diet, or sleep? Drop your answer in the comments. You're not alone, and your honesty might encourage another senior to make positive changes too. Final wrap-up. So let's take a moment and reflect. Your knees are more than just joints. They're windows into your overall health. From arthritis to heart health, from gout to infections, your knees can give you early warning signs long before blood tests or scans do. For seniors and aging adults, 30, 50, 70 plus, protecting your knees means protecting your independence, mobility, and quality of life. Here's what we learned today. The 13 knee conditions that reveal deeper health issues, the foods that protect your joints and the ones that harm them. Home remedies like turmeric tea, Epsom salt soaks, and aloe vera for relief. Daily lifestyle habits. Exercise, posture, hydration, and safety that keep your knees strong well into your golden years. If you take only one thing from today's video, let it be this. Never ignore knee pain or changes in your joints. They may be your body's way of asking for help. Make smart food choices, stay active, protect your weight, and listen to your knees. And if you notice swelling, redness, or pain that doesn't go away, please see your doctor. Early care saves years of struggle later. Now I'd love to hear from you. Which tip today helped you the most? Was it the foods list, the home remedies, or the lifestyle changes? Drop your answer in the comments below. Your experience could truly help another senior watching this video. If you found this video valuable, don't forget to like, subscribe, and share it with a family member or friend. You never know who might benefit from this information. And remember, this video is for educational purposes only. It's not a substitute for medical advice. Always consult with your doctor before making health changes. Stay healthy, stay strong, and keep those knees moving, because aging well is possible when you take care of your health every single day. Watch my next video here on senior health and arthritis care. It might just be the information that changes your life.